While COVID numbers in Michigan continue to be reassuring, there is growing concern about the Delta variant.
Joining us with more on that threat and continued push for vaccinations is internal medicine specialist Dr. Abha. Doctor, good morning. Thanks for joining us.
Brody, Deanna, good morning. Thank you for having me.
Yes, ma'am. Let's start with the sweepstakes here in Michigan, the newest part in everything that's happening with the pandemic. What does that mean for individuals who are going to be taking part in this?
Good morning. At my place of work, we still offer incentivization programs to patients who remain hesitant and uncertain. And what I've found that the incentivization is providing is groceries and food on the table. And so for those people who question why we would need an incentive to save the lives of self and others, I would say this: some people don't have the luxury of knowing what tomorrow will bring, to include food. And so these sweepstakes are a nod by our governor to say, I know you're scared, I know you're hesitant, but I want to add something even more glorious, and it might be just day-to-day living. And for our 12 to 17-year-olds, it might mean a scholarship to get you through college. So I'm quite energized. It was actually introduced by Governor DeVine in Ohio, and he saw a 55% uptick among 20 to 49-year-olds with the implementation of this sweepstakes or lottery. Several other states have followed suit, and Governor Whitmer is among them. So I'm very excited about it, and I'm not afraid to say that I've entered the sweepstakes as well. So remember, it's not for those who have not yet been inoculated. It includes everybody from December to July 30th who intend to be vaccinated or have been vaccinated.
So let's talk a little bit too. Obviously, we've been hearing a lot about the Delta variant. Just your thoughts on that.
So thank you, Deanna. Every single day in my office, I get one of many concerns. I'm scared. I'm afraid of the jab. This doesn't apply to me. I'm going to live to 28 anyhow, so why should I get the jab? The problem lies in this. The Delta variant, the most recent of highly infectious and probably more deadly variants, is among us. And we could go on to infect children, adults, and those as yet unvaccinated. We know that it occupies 20% of the prevalence in the United States. We know there's a doubling every 2 weeks. We also fear that it will overtake the UK or Alpha variant very shortly. And the problem with that lies here. All the strides we have made thus far to include outdoor gatherings, opening up restaurants, getting our kids back to camp, and hopefully getting them back to in-person school will be jeopardized. So I really ask you to understand, go to your doctor. We have cutting edge information. Ask the right questions. If you don't have a doctor, find one. Every single facility has physicians ready at the quick. Just this past week, I met a waiter at a restaurant, and this individual said to me, this doesn't apply to me. I'm going to live anyhow. And I said, but what of the people around you? What of the infectivity of this Delta variant? And 48 hours later, we met at a pharmacy and this individual got the jab. Martin Luther King once said, our lives begin to end the day we become silent about things that matter. This is too important. I'm not being dramatic. I'm being honest. I do this every single day. Get the jab, get excited, get educated, and do the right thing.
Dr. Abha, thank you so much for your professional opinion and your time. West Michigan, don't forget to get signed up for the sweepstakes. Pretty great offerings right there.
All right.